I'm sure you've heard the term slip disc, disc bulge, disc herniation, disc fragmentation, sciatica. All of these things can kind of point to the same thing, but there's nomenclature that really matters. And we're gonna go dive into that a little bit more today. So one of my favorite subjects is low back pain. And we want to get into where some of the clinical reasoning comes from for what we do in the office as chiropractic and rehab specialists versus what maybe a medical doctor may do, and how we can actually integrate together, and it can be based off of like what's going on with the anatomical features. So we're gonna take a deeper dive right here. So I have just the drawing of my beautiful low back here. So I just picked up the few segments. Most disc herniations are gonna happen between L5 and S1. Then it's gonna be L4 and 5, and then L3 and L4. Other ones do happen, but these are the most common, so we're just gonna kind of dive in and keep those, because we're gonna look at the, at the trees in the forest here, not just kind of dive into looking at like zebras. So most low back pain is gonna be happening at this L5, S1. We can use the physical exam to kind of figure out which level it is more. One, just dermatomes, so there's different areas that these nerves go down. Classic areas of where they go down the leg can help us, but then also what muscles they go to can also give us the detective work of which level is being interfered with. So where the pain distribution is, if it's affecting one of the reflexes, right, when you hammer on the Achilles or on the patella, or on the hamstring, can kind of tell us which levels, and also where the myotomes are. Dermatomes, where the areas where it goes, can lie to us, so they're not always syncing up as much as we thought they used to. So we want to go through, but if somebody's been dealing with low back pain a little bit longer, and they go through a little clinical trial, sometimes you have to end up with an MRI. We usually have in my mind what is going on clinically, but there are some of these that get a little bit pickier. So in a disc bulge, which really means that in this area, so this is like the top of a disc. If we do this cross section through, that's what we're seeing here. You can kind of picture here, this is the vertebral body, and then this is the disc that's sitting in between. This is the nucleus pulposus. This is what it kind of makes of the jelly part, and then we have annular rings that kind of go through. What can end up happening through compression, flexion, rotation? This can kind of bulge, and we can end up with broad-based bulges, narrow bulges, but basically this area starts to increase. So we'll end up, this squishes down, and this will look like this on the lateral view as we come through. So we'll see a little bit of a bulge. Then we can end up with something like a little bit more where we have this kind of pushes through, the nucleus trying to push us through, and then we end up with like a herniation where we end up with like a more focal area that's going. So we can have this broad-based bulge with a herniation, and that can be broken into a couple different areas. We're gonna have like a protrusion where this is coming out and it's going out more into the space and can be nicking on a nerve, and it's more focal. Then we can end up with a couple other things where this can end up happening, where this can migrate. So this disc material can actually go up within this area and migrate up or down, depending on what happens to the body. Body's unique. Or what can end up happening is we can end up with the goo gets on the outside, and we end up with a sequestration or a fragment that can sit into the spine that can push onto a nerve. This is getting a little bit more into the weeds, but all of these things matter on what we can see clinically, but also what the management can be. And this is like a lot of times we get to these fragments, these are being integrated in with a team effort. So this is where we get in with a pain management as well as getting a spine consult. Kind of depends on what the symptomology is, but this can help us lead us on what direction we need to go to if we're not getting the results in the clinic.